Hello, everybody. How are you doing? Well, we have another Thursday and another HBMA Live. So, welcome to HBMA Live, and I'm glad this is our second HBMA Live from last Thursday. And welcome to HBMA. And thank you for joining it so that you are aware about the activities HBMA has been doing for our members. We have fantastic growth in past 6 months since we have our new company took over. Brad and his team took over the management of association. I was reading through our journal, and we have some fantastic data and figures for you. We have 53 new members who joined HBMA in last 6 months. So that is a fantastic news, because if you don't have new members and old members returning back, then we don't have enough people to do networking, use education for each other, talk to, and we need a perfect combination of vendors, industry, uh, industry experts, subject matter experts, people who understand compliance, people who understand medical billing and coding. So that is the reason the entire board of HBMA has been working very hard, so that we can have more and more people, industry experts, coming under the roof, one roof, and talking about common issues. I'm going to give you a little, actually, one more good news. We started our digital journal, which is called HBMA Journal back. And our second edition of HBMA Journal, which is called RCM Advisor, it is out, and it has our new management, our president's message on the top, Lyndon Tukey, who has you know who has created a little overview, and who has given a little overview of HBMA, our goals, our mission, our vision, why we are doing what we are doing. And also, in this journal, you would find the HBMA's 2023 goals, which is, we have three areas of opportunities, where we add value to the RCM industry. So we are going to talk about networking, which is most important part and most important pillar of our HBMA's goal. So this year we are going to have three conferences coming up. Compliance course is going to be in February, which is in Nashville, Tennessee. And then our owners and managers conference and the fall conference in Indianapolis. So the fall conference, we have March 20th to 24th, in which it will be joined by four commercial payers: Aetna, Cigna, Humana, and United Healthcare. So it's going to be a great 5 days of collaboration and education. Registration has started on our website. You can go on hbma.org. You can register for fall conference as well. So that is about networking. The second and most important fundamental mission for HBMA is education. So HBMA is committed to enhancing educational offerings in 2022, and we have much more in store for our members in 2023. So we have a new learning management system, which would be customizing our curriculum and classes and online training for our members. So that is also coming. So that is a great news for people who wants to join HBMA for education purpose. And third thing, we are also focusing on individual career development. So we have a CHBME, which is our certification program. You can apply for CE opportunities, and then that certification demonstrates to your clients and industry peers that your knowledge and skills align with industry standards, and that you are a true, reliable, accountable, and trusted revenue cycle management professional. So with these three pillars in our goal, three missions: networking, education, career development. HPMA is adding a great value addition for yourself. If you're still contemplating to join HPMA, my suggestion would be to join it ASAP. In our HPMA, if you go back to our journal, this journal is exclusively for members only, and you can only find it when you go on our website, hbma.org. You log in with your username and password, which you only get once you sign up as a member. It has messages about what I have talked about already, the HBM's future programs, but it also has some amazing articles by our members. And it has an article about, you know, public policy. It has article about real-time leadership, and it has a very good article which is a featured story. Why do owners of RCM companies sell their business? This story is by Madeline Berger, and she is talking about different techniques and different ways, and what motivates you to sell your business and at the same time to buy another medical billing company. Um, there's another feature story called Payers Are Unresponsive. So when payers are unresponsive, what do you do? And that story is by Olga, and it covers enrollment, credentialing, and billing questions. So the entire story is on our new HPMA RCM advisor. Again, you can log in online, see it, read it. There are two more articles which I would like to talk about. One is by myself, Kunal Jain, and where I have been talking about how to use technology to improve patient collection. Because remember, in HBMA, we have a lot of vendors, a lot of technology vendors, and I have met so many new technology vendors who comes to HBMA, and they give you fresh ideas, they give you fantastic ideas, and some of those ideas really work. So I have spoken about in this article what ideas can work to improve your patient collection. Because if you are a company or revenue cycle providers who are still doing the old traditional way of patient collection, it's not going to work. So using technology to improve patient collection, you can read the entire article in this RCM advisor. Another one, which is how you can use new CPT codes, which includes burden reducing revisions. So this article is taken, actually this is a reprint from American Medical Association, and we are republishing it with their permission. And then there is one more article by Chad, which says summary of current and 2023 HIPAA right of access requirements. So a lot of good education, a lot of good articles are going to be in this journal. We have an article from our, keynote speaker, longtime HBMA friend Dave Chakilo. He has talked about fixes for healthcare part 1. And there's a coding corner by Melody, and she's talking about what will we get paid for it. So my suggestion is, if you have not signed up for healthcare HBMA membership, apply for the membership, sign up for membership. It has got great value planned for year 2023 and 2024. Now with this, I'm going to invite our guest today, who is going to be speaking about compliance course on February 6th to 8th, which is our spring compliance course conference happening in Tennessee, Nashville. So I would invite Carrie. Hello, Carrie. How are you doing?
Hey, how are you doing?
Fantastic. Thank you very much for taking out time to speak to HBMA Live. And we are very excited about February 6th to 8th, what our members are going to get from you guys. So tell us a little bit about yourself and tell us about the course we are going to offer during these 2 days of our conference.
You bet, happy to. So, I'm Carrie Aiken. I am the Chief Compliance Officer and Privacy Officer at Navitus Health Solutions. Navitus Health Solutions is a pharmacy benefits manager. And pharmacy benefits is an interesting perspective from the HBMA side of the world because it's not typically revenue cycle, but we share many of the same interests as revenue cycle because, like revenue cycle for medical billing, we are also a third party that is honoring the client contract and working through compliance requirements much in the same way as a medical billing service or other revenue cycle provider would be. I do have an extensive history of working in revenue cycle on the physician and provider side. I had done that for 10 years and have been acquainted with health billing management for the Health Billing Management Association for many years, having been an attendee at the HBMA compliance conference for several years prior to joining the faculty back in, I think it was 2015 or 2016. And I've had the opportunity to participate with HBMA in varying capacities since then. I have been in healthcare for over 30 years and
Wow.
worked with hospital, physician, home health, durable medical equipment, hospice, and pharmacy, along with medical billing and revenue cycle. And I've been involved in compliance for over 20 years and certified in healthcare compliance since 2011. So this is truly a passion of mine to advocate for compliance and really bring that compliance awareness message to people in a way that is not only accessible but operational. Because if you don't build meaning through the education of compliance, then you really just shared words and legalities, and that doesn't get you very far.
So, who are your clients right now as a consulting? Is it mostly billing companies or medical groups or practices? Who are you?
So it's neither. So on the pharmacy benefits side, we work with health plans and employer groups. So it's really a benefits management service in the pharmacy space. However, we have to work very closely and understand the inner workings of what's happening on the physician billing side because they're just like everybody else. They've got to prove
Mhm.
medical necessity for those prescriptions. So while we're working more with the payer side of the equation, that has a direct effect on the physicians. And as a result of that, we are well acquainted with all of the activity on the revenue cycle side because we also serve in helping support the revenue cycle to pharmacies. So we have the advantage of knowing the revenue cycle from the payer side of things and knowing what best practices are, and helping affect change in a way that allows the providers to get their reimbursement more quickly.
How are you going to do it on 6th? I know you are a speaker on one of the sessions, and
Yeah,
your
I'm
partner
actually
is doing the another session. So what's the plan for these 2 days?
Yeah, so we are really going to tackle compliance from the perspective of the effective elements. As many folks know, an effective compliance program is built around elements that are required not only from the OIG, the Office of the Inspector General in Health and Human Services, but also the U.S. sentencing guidelines as well as the DOJ. And our sessions really revolve around exploring those elements and bringing clarity to those elements in a way that's very practical, and give people meaningful tips and tricks and things to think about, whether they are very experienced compliance professionals or if they are new to the compliance arena. We want to make sure that we touch all of those different levels of experience and capability. And so our sessions will cover those particular aspects. For myself in particular, as the privacy officer at my organization, I'm really going to tackle the privacy and security elements, but also really build that out in a discussion of cyber connections in such a way that we will look beyond what HIPAA rules are. Everybody's very familiar with HIPAA, but that's really now the floor. That's kind of the baseline of what everybody expects you to do. So how do we up our game, right?
So what are the like? Can I ask you these questions? What
Yeah,
are the repercussions for? So if let's say somebody is caught violating HIPAA rule or something, I have read different
yeah,
newspapers, different things, and different articles. But in a normal scenario, if a medical information is breached for a
yeah.
patient, how far the repercussions can go? Well,
Yeah, that's a fantastic question. So, within your organization, there's going to be some sort of mechanism for sanction or discipline or re-education, depending on what the scope of that exposure is, your particular history with compliance, and what the risk is to the organization. And every organization needs to figure that out on their own. And then from an enforcement perspective, there are degrees of reporting that need to take place either at a state level or with HHS Office for Civil Rights. And when it escalates to those levels, those different agencies will take their own protocols and review under advisement, and they will determine if there's evidence, if they want to undertake an audit, if they want to engage in enforcement. And law enforcement, if they take it forward, they would typically issue some sort of charge or fine or penalty. The Office for Civil Rights is a little bit different. There's no fair trial, there's no judge and jury. They just go through the
so who
exercise.
comes after you? Is it CMS who comes after you or different agencies when
It's
a
Health
breach
and Human
happens?
Services Office for Civil Rights.
Okay.
They are the arm of HIPAA. And
Okay.
so, yep. So they don't.
So, and who complains to them? Patient goes and complains that my information was
Sure.
leaked or something.
Uh, Absolutely, a patient can complain. It can also evolve out of self-disclosure. So there are obligations that we have with reference to reporting incidences, reporting breaches, reporting security incidents if there is an exposure of information that was unsecured. And so the Office for Civil Rights can derive an investigation from that
Office
self-reporting.
for Civil Rights.
Office for Civil Rights, yeah,
Mhm.
they can um, derive an investigation from
So
self-reporting and
when
pursue
these
it there.
patients, how do patients know that they have to complain to that place? Where does patient call 911 or what do they do?
So it's a great question. So every provider or health plan has to have within their notice of privacy practices.
That if you find a
Yep,
leak, they themselves are telling if you have a problem, you find a
yep.
leak
You
on
can
that
report
notice,
it
you
to.
call this
Yep.
number.
You can report it to the provider or the health plan directly, or you can report it to the Office for Civil Rights. Absolutely.
And if a patient, so patient end up talking to their attorneys. That's what most of the time it happens.
Sometimes the report goes directly to the Office for Civil Rights.
Right. And then the office starts getting a letter from these attorneys
Mhm.
asking for settlement, basically.
So usually an attorney is not escalating things to the Office for Civil Rights. If somebody is going to engage in a private right of action or attempt of private right of action under HIPAA, they would do so through their attorney directly with the organization. But if somebody makes a complaint to the Office for Civil Rights, the Office for Civil Rights will engage directly with the provider themselves or the health plan themselves and conduct their investigation. It will be the Office for Civil Rights attorneys involved, but not the individuals
What
personally.
other type of violation can happen? One is HIPAA.
Yep.
What other type of breach which patient can report or
Sure. So
find out?
there's lots of different elements. So the things that are reported under HIPAA typically are protected health information.
Correct.
There are other elements that are considered personally identifiable information that may not qualify as health information, like a banking account number or a checking account number or a credit card number. Those are things that may be reportable under some of those regulations or under state data breach rules for personally identifiable information. And you need to report that to either the state consumer agency or the attorney general.
So I was told, and it happens a lot of time. Our doctors, I mean, we have a medical billing company. They
Hmm.
say, "Oh, we are receiving this letter from a new merchant account company or new bank,
Hmm.
and they are threatening us that we have, if you leave a patient credit card number on a piece of paper,
Hmm.
it is not legal. You can't do that anymore."
Yep.
And that like freaks out our, because everybody, all these girls who sit in the front, they receive a phone call, they have a habit of writing something on a piece of paper, and of course either it can be a patient name or it is a patient information or credit card numbers and all of that good data,
Hmm.
and the data goes in the in the garbage end of the day. But how do you think this is all a violation, like everybody else is saying?
So those are also the PCI rules, the Payment Card
Correct.
Industry Standard Data Security Standard rules. So to the degree that it violates the PCI rules, PCI is a voluntary enforcement organization. So it's, comprised of Visa,
So
Mastercard,
it's
Discover,
voluntary
Amex.
because we receive a lot of these PCI threats that they come up with some kind of stupid
Yeah.
software, put it on your
So
computer, and they
so
say,
what I
"Oh, you don't have adequate firewall. Oh, you don't
so
have an adequate antivirus."
No. So what I mean in terms of voluntary is that you don't have to participate in a credit card, right? So
Okay.
if you participate with the credit card and you meet the merchant standards, you have to adhere to PCI. And the enforcement there is that if there's a violation and Visa or MasterCard or American Express, if they have concerns, they will pull your rights to process credit cards. That is their enforcement mechanism, but they're
So
not
they
an
said
agency.
if you use a credit card machine or if you use those
Yep.
standards,
Yep.
then you have
If
to
you
follow certain standards. Otherwise, don't use it.
Correct. Correct. So
Right.
if you're processing credit cards, there's nothing that requires you to take a credit card, but as soon as you do, you are agreeing to participate under the PCIS rules or the PCI DSS rules. But that is not federal or state enforcement.
So it's not a conviction. It's not a crime. Like even if that happens, that breach, they can't.
So right. And so what you have to think about, Kunal, is it's not just one rule, right?
Correct.
So there's different layering. So you have the PCI DSS rules, but if your state rules also incorporate credit card data as part of a data breach under personally identifiable information, then you also have to factor in those rules as well. So it's not just one rule exclusively. You can have layers of rules, which is challenging,
Right.
very challenging.
Very challenging. I mean, we we give them the answers. So most billing companies give them the answer based upon the common sense and what they read out
Yeah,
of that vendor. But
yeah,
there is we don't find this general guidelines that you have to follow this or not, because
yeah,
sometimes a physician can be really picky and he says, "Wow, I don't want to go jail. I don't want to do this." But
yeah,
somebody needs to tell them, "Hey, this is suggestive and this
yeah.
is mandatory. You have to do it." So there is a difference between
Right.
everything. Yeah.
And it's a lot of it is common sense.
Yeah.
If you don't have to write it down, don't write it down. If you
Right.
don't have to look it up, don't look it up.
Right.
If it's not part of your job, don't look it up.
Yeah.
If it's documented, great. If it's not documented, not great. So you have, a lot of these things are things that are just good business practices regardless of all the rules.
I have, since you are in pharmacy, actually, I wanted to ask this question because this
Sure.
comes to our mind all the time. We receive calls sometimes in our call center. Patient says, "Oh, I received a call from this pharmacy, and this pharmacy wanted to fill up our prescription, but we never gave that. This is not our pharmacy. We never gave this information to this pharmacy. Who gave our data? Who has rights to give our data to that pharmacy? How come these people get these calls? Who sold that data to them? Because that's a clear cut violation of their privacy laws."
I can answer that question. So, a lot of it is clickbait,
Not
and
of it what?
it's clickbait schemes. And let me explain because it's a
Uh-huh.
fascinating story. So, a
Hmm.
lot of people that have these kinds of experiences where they're getting drugs and they don't know why,
Yeah.
or they're getting prescriptions and they have no clue where they came from. A lot of them have chronic conditions and maybe diabetes, maybe COPD, maybe asthma,
And
what
they're
have you.
old people mostly.
Yes. And so what ends up happening is these people will go on to websites, because maybe this diabetic website, they'll offer you a great new recipe for, low fat
Right.
chicken or
Yeah.
some dessert that is sweeter than you thought and you're
Right.
having a treat kind of thing. And so these websites, they require you to sign up personal information. And some of them will go so far as to say, include your Medicare information so I can send you benefits or specials that may be helpful for you as a Medicare enrollee. And people put this information in. And what they don't realize is in these websites, people are then selling that information sometimes behind
To
the scenes
somebody else. So they are
to
basically
unscrupulous.
signing up.
Yep.
But some people are very sure. They said, no, we don't have computer. We have never signed up. So do you think this also happens? These payers also sell the data, a relevant data, if it comes out of your EHR or anything. Is that the data migration or data sell, buy and sell happen in real
So
time?
payers cannot sell data. Any covered entity under HIPAA
Hmm.
cannot sell data without the express authorization of a patient. So
The patient signed a bunch of papers at the time of
correct,
admission. We don't know what
but
they
it has
signed.
to be but it has to be a very specific marketing type authorization or specifically say we are going to sell your data. It's not likely the health plans that are doing it. It could be a
Credit card
subcontractor of a
company. I don't know
subcontractor.
who's doing it.
Yeah. Could be a subcontractor of a subcontractor down the road. But I will tell you this, there are very aggressive phone services that will hook you in to get braces, orthotics.
Yeah, DM me all the time.
Yep, all the time. And
Yeah.
those services, if they get your hands on that information, they also forward those
Well,
over
where did they
to,
get that information from?
if they call, they will pressure
Well,
people.
how did they get on my number? How do they know that I need that?
You can get those things from voter rolls, voter, like
I
voter
know, but how
registration.
would they know that I need a brace?
They can just from a voter ID rolls. They, like how long was the person at address? A lot of this information is public, and they crunch this information to figure out who their targets are. Say these are folks that are
Or
expected to
they
be
just
Medicare age.
assume that he's a 65-year-old
Sure.
year old
Yeah.
man, but they don't have the history of
No.
their present
Nope.
illness or
Nope.
history of their, but
Correct.
on the basis of just their
Yep.
age and basis
Yep.
of their demographic
Yep.
information, they guess.
I absolutely know because my parents get these calls. Yeah.
So, but you are sure that it's not the data stealing which is happening anywhere in the pipeline in this whole scenario, or a data breach happening. Data breach may happen, but that's a part of.
Yeah. Usually those kinds of scams are very, very well orchestrated, and there is a whole process, a whole marketing scheme around bringing that information into the fold. It's not from a data breach.
It's very interesting. Oh my God. I get surprises all the time. Like there's one last question and then we'll end this up.
Yeah.
How do this errors and omission policy? It's just getting so expensive. Damn it. In last 10 years, if I remember buying the errors and omission policy was probably $1,000 a year, but now
Hmm.
it's $10,000 a year.
Yeah.
What went wrong? What happened? Why so? What is that we are paying for?
Well, and it depends if cyber is included in your errors and omissions policy, and
Right.
that's usually what's launching it up is the cyber piece
But do
of
you
that.
think that is the only protection against these things, what we talked about, or if anything?
Well, good HIPAA hygiene is going to help lower that. And usually cyber policies will take into consideration the strength of your posture, your privacy and security posture,
Uh-huh.
but simply the number of breaches that have happened and the
Mhm.
number and scale of those breaches has gone up and the magnitude, and I think also the visibility around them. And when you look at the number of cyber carriers that are out there, there are fewer and fewer of them.
Yeah.
And so it allows them to raise their premiums because there's less and less coverage.
Hmm.
So,
Well, so people, anybody who is listening us today or who is going to listen us, this is an opportunity for all of you guys to answer these questions directly from Carrie and Holly, right? That's your partner who's going
Holly,
to be
yep,
there.
you bet.
Holly is going to be there February 6th to 8th. We still have the registration lines open. You can sign up, meet us there at HBMA Spring Compliance course. With this, thank you very much, Carrie, for coming on
You
board.
bet. Happy to be here. Thank you.
Thank you. Well, have a wonderful day ahead. It's a Thursday evening here in Florida, and I will see you in our next HPMA Live. Thank you, guys. Thank you very much.